Welcome back, and I'm genuinely glad you're here today because what we're about to discuss affects nearly every person over the age of 70 in one way or another, yet it remains stubbornly under-discussed in most doctors' offices. We're talking about leg circulation, the ability of your blood to travel efficiently down from your heart through your arteries, into the tiny capillary beds of your feet and toes, and then back up through your veins against the relentless pull of gravity. That round trip is one of the most demanding jobs your cardiovascular system performs, and it becomes significantly harder with every passing decade. Why does this matter so much after 70? Because poor leg circulation isn't just about discomfort, it's a domino chain. Reduced blood flow means less oxygen reaching your muscles, which means fatigue and cramping. It means slower wound healing, a small cut on your shin or a blister on your foot that should close in days instead lingers for weeks, opening the door to infection. It means increased risk of deep vein thrombosis, those dangerous blood clots that form in sluggish leg veins and can travel to the lungs with catastrophic consequences. And it means peripheral artery disease, PAD, a condition where narrowed arteries starve your lower extremities of the blood they need, affecting an estimated 8 to 12 million Americans, with the highest rates concentrated squarely in adults over 65. Poor circulation in the legs is not a minor inconvenience. It is a warning light on the dashboard of your body, and ignoring it carries serious consequences. So, what's this vitamin? Let's get to it. The number one vitamin I want every senior over 70 to know about for leg circulation is vitamin B3. Specifically, a form of it called niacin. Now, you might have expected me to say vitamin D, or maybe vitamin E, or perhaps one of the trendy supplements flooding late-night television commercials. Those all have their roles, and we'll touch on supporting nutrients shortly. But when it comes to direct, measurable, well-documented impact on blood flow in the legs, niacin stands in a category that most other vitamins simply cannot match. Let me explain why, and I'm going to keep this simple, because the science, while fascinating, doesn't need to be complicated to understand. Niacin does three critical things inside your blood vessels that directly improve leg circulation. First, it is one of the most potent natural vasodilators known to medicine. Vasodilation, that's simply the widening of blood vessels. When your arteries and smaller blood vessels relax and open wider, blood flows through them with less resistance. Think of it like a garden hose. If you pinch the hose, water trickles. Release that pinch, and water rushes through. Niacin helps release the pinch. It triggers the release of prostaglandin D2 in your skin and blood vessels, a compound that causes vessel walls to relax and expand. That warmth and flushing sensation some people feel when they take niacin, that's vasodilation happening in real time. Blood is rushing more freely into areas, including your legs and feet, that may have been partially starved. Second, niacin has a profound effect on your blood lipid profile, your cholesterol, and not in a small marginal way. Niacin is one of the few substances that simultaneously lowers LDL cholesterol, the harmful kind that builds plaque inside artery walls, raises HDL cholesterol, the protective kind that helps sweep plaque away, and reduces triglycerides and a particularly nasty particle called lipoprotein A, which most standard cholesterol drugs barely touch. Plaque buildup inside the arteries of your legs is the primary mechanical cause of peripheral artery disease. By improving your lipid profile across multiple fronts, niacin addresses the root cause of arterial narrowing, not just the symptoms. Third, niacin reduces inflammation within the blood vessel lining itself. Chronic low-grade inflammation is the silent accelerant behind nearly every form of cardiovascular disease. It makes artery walls sticky, vulnerable, prone to collecting the fatty deposits that eventually harden into obstructive plaque. Niacin dampens that inflammatory cascade, helping to preserve the smooth, flexible inner surface of your arteries, the endothelium, so blood glides through rather than encountering a rough, damaged corridor. Three mechanisms: wider vessels, cleaner vessels, healthier vessel walls, each one independently beneficial. Together, they create a compounding effect on circulation that your legs can physically feel. Here's the part that frustrates me. Many seniors over 70 are walking around with suboptimal niacin levels, and virtually nobody is screening for it. Why are older adults particularly vulnerable? Several overlapping reasons. Appetite decline. After 70, caloric intake drops. Meals get smaller. Variety narrows. The richest dietary sources of niacin, chicken breast, turkey, tuna, salmon, liver, peanuts, mushrooms, green peas, fortified grains, often fall off the plate as cooking becomes burdensome or appetites shrink. A senior eating toast and soup for most meals simply isn't getting adequate B3. Medication interference. Many common prescriptions taken by older adults affect niacin metabolism or increase the body's demand for it. Certain diuretics, water pills frequently prescribed for blood pressure, increase urinary excretion of B vitamins. Long-term use of isoniazid for tuberculosis exposure, certain chemotherapy agents, and even excessive alcohol consumption deplete niacin reserves. Digestive absorption issues. The aging gut absorbs nutrients less efficiently. Stomach acid production decreases. Chronic conditions like gastritis, celiac disease, and inflammatory bowel issues, all more common in later life, further compromise how much niacin your body actually extracts from the food passing through it. Chronic disease burden. Diabetes, kidney disease, liver conditions. These metabolically demanding states increase the body's consumption of niacin while simultaneously impairing its processing. A 75-year-old managing type 2 diabetes and mild kidney insufficiency has dramatically higher niacin requirements than a healthy 40-year-old, yet is far less likely to meet even baseline needs. Many seniors ignore the signs. The fatigue gets blamed on age. The leg heaviness gets chalked up to arthritis. The tingling in the toes gets attributed to just getting old, and while aging does bring genuine changes, accepting every symptom as inevitable without investigating nutritional causes is a mistake that costs people mobility, independence, and quality of life. So how do you actually increase your niacin intake in a safe, practical way after 70? Let me walk through this carefully, because dosing matters, form matters, and doing it correctly makes all the difference. Dietary sources first, always. Food is your foundation. The richest sources of preformed niacin include chicken breast. A single 4-ounce serving delivers roughly 14 milligrams, nearly the entire daily recommended amount. Turkey breast is comparable. Canned light tuna provides about 11 milligrams per serving. Salmon, particularly sockeye, offers roughly 9 milligrams. Peanuts and peanut butter are excellent plant-based sources. A quarter cup of dry roasted peanuts gives you about 5 milligrams. Mushrooms, particularly portobello and cremini varieties, contain meaningful amounts. Fortified breakfast cereals and enriched whole grain breads contribute several milligrams per serving. A simple goal: try to include at least one strong niacin source at both lunch and dinner. A turkey sandwich on enriched bread with a small handful of peanuts as a snack, and you've likely met your daily need from food alone. If you're over 60 or caring for an elderly loved one, this information could be life-saving, because knowing that circulation problems in the legs have a nutritional component, one that is correctable, shifts the entire conversation from helplessness to action. Supplementation with guidance. If dietary intake is insufficient, or if your healthcare provider identifies a deficiency through blood work, niacin supplementation becomes a reasonable conversation. The recommended dietary allowance for adults is 16 milligrams per day for men and 14 milligrams for women. Therapeutic doses used to address circulation and cholesterol, typically ranging from 500 to 2,000 milligrams daily, are vastly higher and absolutely must be supervised by a physician. This is not a vitamin you megadose casually. The reason for caution is the niacin flush, that intense warmth, redness, and sometimes itching of the skin that occurs when higher doses cause rapid vasodilation. While medically harmless, it can be frightening if unexpected, and for some seniors, uncomfortable enough to cause anxiety. Extended release formulations reduce flushing significantly, but require liver function monitoring because they carry a slightly higher risk of hepatic stress at sustained high doses. There is also a form called niacinamide or nicotinamide, which does not cause flushing. However, and this is crucial, niacinamide does not produce the same vasodilatory or cholesterol-modifying effects as true niacin. If your specific goal is improving circulation, niacinamide is the wrong form. You need actual nicotinic acid. This distinction matters, and it's one that many supplement labels obscure. Talk to your doctor before starting any niacin supplement beyond basic dietary levels. Bring this video up if it helps start the conversation. Ask specifically about your current B3 status, whether testing is appropriate, and what form and dose would be suitable given your medications and health conditions. Niacin doesn't work in isolation inside your body. Several other nutrients create a synergistic environment that amplifies its effects on leg circulation. Think of niacin as the lead musician and these as the rest of the band. The performance is strongest when everyone plays together. Vitamin C. Ascorbic acid is essential for collagen production, and collagen is the structural protein that keeps your blood vessel walls strong and resilient. Weak vessels can't respond properly to vasodilation signals. Vitamin C also functions as a potent antioxidant, protecting the endothelial lining from oxidative damage. Citrus fruits, bell peppers, strawberries, broccoli, and kiwi are excellent sources. Aim for at least 75 to 90 milligrams daily. An orange and a half cup of raw red bell pepper gets you there easily. Vitamin E. This fat-soluble antioxidant has mild antiplatelet properties. It helps prevent blood from becoming overly sticky and prone to clotting. For leg circulation, particularly in veins where clot risk increases with sluggish flow, vitamin E plays a protective supporting role. Sunflower seeds, almonds, spinach, and avocado are strong sources. Keep supplemental doses moderate. High-dose vitamin E has shown mixed results in large trials and can interact with blood thinners. Magnesium. Often called the relaxation mineral, magnesium is directly involved in blood vessel tone. Deficiency, which affects an estimated 50% of Americans over 70, contributes to vasoconstriction, muscle cramping, and elevated blood pressure, all of which worsen leg circulation. Dark leafy greens, nuts, seeds, black beans, and whole grains are rich sources. Magnesium glycinate is generally the best tolerated supplemental form for seniors, less likely to cause the digestive upset that magnesium oxide frequently triggers. Omega-3 fatty acids. Found abundantly in fatty fish like salmon, mackerel, sardines, and in flaxseed and walnuts, omega-3s reduce systemic inflammation, lower triglycerides, and improve the flexibility of red blood cell membranes, literally making your blood cells more pliable so they can squeeze through narrow capillaries more efficiently. 2 to 3 servings of fatty fish per week provide meaningful benefit. Together, this nutritional constellation, niacin at the center, supported by vitamin C, vitamin E, magnesium, and omega-3s, creates an internal environment where blood vessels relax, blood flows freely, inflammation recedes, and the tissues of your legs receive the oxygen and nutrients they are desperate for. Nutrition is powerful, but pairing it with specific daily habits multiplies the results, and none of what I'm about to suggest requires a gym membership or athletic ability. Walk. 15 to 30 minutes of walking per day is the single most effective physical intervention for leg circulation in seniors. Walking activates the calf muscle pump. Your calves literally squeeze the deep veins of your legs with every step, pushing blood upward toward your heart. This mechanical pumping action is irreplaceable. No supplement can mimic it. If walking continuously is too demanding, break it into 3 10-minute sessions throughout the day. The cumulative benefit is nearly identical. Elevate your legs. Twice daily, lie down and prop your legs on 2 or 3 pillows so your feet rest above the level of your heart. 20 minutes per session. This simple position uses gravity to assist venous return, reduces ankle swelling, and gives your circulatory system a rest from fighting the uphill battle. It wages every moment you're upright. Do this mid-afternoon when swelling typically peaks and again before bed. Stay hydrated. Dehydration thickens your blood. Thicker blood flows more sluggishly, particularly through already narrowed or compromised vessels. Many seniors underhydrate because thirst sensation diminishes with age. Aim for 6 to 8 glasses of water daily. Keep a filled water bottle visible as a constant, gentle reminder. Herbal teas count. Broth counts. The fluid doesn't have to be plain water, but it does have to be consumed consistently. Avoid prolonged sitting or standing. If you sit for extended periods, reading, watching television, traveling, set a timer to stand and move for 2 to 3 minutes every hour. Flex your ankles. Roll your feet in circles. March in place. These micro movements prevent blood from pooling in your lower legs, where it becomes vulnerable to clotting and contributes to that heavy, aching sensation. Compression stockings. For seniors with visible varicose veins, chronic ankle swelling, or diagnosed venous insufficiency, graduated compression stockings are profoundly effective. They apply gentle, calibrated pressure, strongest at the ankle, gradually decreasing up the calf, that supports your veins and assists blood flow upward. Your doctor can recommend the appropriate compression level. Many modern styles look and feel nothing like the thick beige stockings of decades past. They come in various colors and comfortable fabrics now. While nutrition and lifestyle modifications are tremendously valuable, certain symptoms signal that professional evaluation is not optional, it is urgent. Please take this section seriously. Persistent leg pain while walking that stops when you rest. This is called intermittent claudication, and it is the hallmark symptom of peripheral artery disease. The pain typically occurs in the calves but can affect the thighs or buttocks. It is predictable, reproducible, and directly related to exertion. Do not dismiss this as simply being out of shape. Wounds on your feet or lower legs that will not heal within 2 to 3 weeks. Poor arterial circulation means insufficient blood supply to fuel the healing process. A non-healing wound on an elderly foot can escalate to infection, tissue death, and in the worst cases, amputation. Any wound that stalls deserves immediate medical evaluation. Skin color changes in your feet or lower legs. A dusky, bluish, or purplish discoloration, particularly when the leg is hanging down, indicates inadequate oxygenated blood reaching the tissue. Pale or waxy skin that feels cool to the touch carries the same significance. These aren't cosmetic concerns, they're circulation alarms. Sudden onset of a cold, pale, painful leg, especially if accompanied by numbness or inability to move the foot. This may indicate an acute arterial occlusion, a sudden blockage cutting off blood supply. This is a medical emergency requiring immediate treatment, the same way a heart attack is an emergency. Call 911 without delay. One leg swelling significantly more than the other, particularly if the swelling is accompanied by warmth, redness, or tenderness in the calf. This combination raises serious concern for deep vein thrombosis, a blood clot in the deep venous system. DVT requires urgent diagnosis and treatment to prevent the clot from dislodging and traveling to the lungs. None of these signs should wait for a scheduled appointment. None should be tested with supplements first. They require a medical professional, imaging, and potentially immediate intervention. Let's gather everything together. Your legs have carried you through 7 decades or more of living. Every step of every day you've been on this earth, they've been working, climbing stairs, chasing children, standing through long shifts at jobs you may or may not have loved, walking down the aisle, pacing hospital hallways, kneeling in gardens. They deserve your attention now. Niacin, vitamin B3, is the #1 vitamin for leg circulation because it works on 3 simultaneous fronts: widening your blood vessels, improving your cholesterol profile to reduce arterial plaque, and calming the chronic inflammation that damages vessel walls from the inside. Most seniors are not getting enough of it, and the consequences show up as heaviness, cramping, tingling, swelling, and that bone-deep fatigue in the legs that too many people accept as the unchangeable price of aging. Pair niacin-rich foods, chicken, turkey, tuna, peanuts, mushrooms, with supporting nutrients like vitamin C, vitamin E, magnesium, and omega-3 fatty acids. Walk daily, even if it's just around the block. Elevate your legs, drink your water, move every hour, and please pay attention to the warning signs we discussed. Pain with walking, non-healing wounds, color changes, sudden swelling. Your body communicates clearly when something is wrong. The only question is whether you're listening. You are not too old to improve your circulation. You are not too far along to benefit from better nutrition. Every single positive change you make starting today sends more oxygen, more warmth, more life flowing down into the legs that have carried you this far. They've got more carrying to do. Let's make sure they're ready. If this video gave you something useful, one fact, one tip, one moment where you thought, I didn't know that, please hit that subscribe button. We release new senior health content regularly, and every video is made with you and your well-being specifically in mind. Share this with a friend, a spouse, a sibling, an aging parent, anyone over 70 who has mentioned leg pain, swelling, or cramping. Sometimes the right information at the right moment changes everything. And leave a comment below telling me, do your legs bother you? Have you tried niacin? What's worked and what hasn't? This community learns from each other, and your experience matters to someone scrolling through these comments right now looking for answers. Take good care of those legs. They've earned it.